Hello, everyone. Welcome. Thanks for joining us today on the next presentation in our series of webinar forums on managing stress. This is a joint production of the University of Iowa Hospital's Department of Psychiatry and the hospital COPE team and the University of Iowa Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller from the Department of Psychiatry. I have an important announcement before we get started. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, please dial 911 or go to your nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties express or implied with respect to the information provided herein or to its use. Okay, now on with our program. We have a great one for you today. There will be time at the end for a limited number of questions at the end of the presentation. If you're joining us for the live stream, you can submit questions via the chat function. Further resources and a recording of today's program will be available on the Loop later, and you can access it through the hospital website. Our presentation today features Dr. Jamie Elizalde, Clinical Assistant Professor of Psychiatry, and Dr. Todd Kopelman, Clinical Associate Professor of Psychiatry. Drs. Elizalde and Kopelman have a great deal of expertise in working with children and families. The topic for today is how to talk to and support your children during the coronavirus pandemic. During their presentation, Drs. Kopelman and Elizalde will share ideas for helping children and teens do as well as possible during this time of uncertainty. Here to tell you more without any further ado are Drs. Kopelman and Elizalde.
Thank you for that warm introduction, Dr. Fuller. Dr. Kopelman and I are very excited to be able to talk to you all today, and we appreciate you tuning in for the best interests of your families. I just want to kind of have everybody step back for a minute and remember what's happening right now. You'll see on the agenda, I've labeled this the new normal with a question mark. For some of us, we're settling into new routines, and it starts to feel a little bit normal, but there's still a lot of uncertainty. And this applies to our children and teens as well. So thinking about all of the changes that have happened very rapidly over the last month or so, we now have social distancing, connections have changed. We have altered schedules and routines, and lots of surprises thrown into those that maybe we aren't anticipating just yet, like using Zoom and connecting to the internet from home for all different sorts of activities. For our children and for us as adults, there are lots of milestones or customs that are changing or not happening as we would hope or expect. For our children, this might mean birthday parties. It might mean missing a graduation ceremony that they had been anticipating. It might mean not being able to play their favorite sports, being on their teams, end of the year field trips, other family events. These are all changes for us that we're kind of coping with on a daily basis, and sometimes they catch us off guard. There's also the uncertainty that surrounds the COVID-19 and understanding what it means and when these timelines are going to change. So again, I just want everybody to be aware of those things and understand that this uncertainty and newness leads to an increased sensitivity for all of us, and it can lead to some very big emotions. And those are normal reactions given what we're experiencing. So in a way, this is our new normal. So what Dr. Kopelman and I want to do today is talk to you about some ways that you might try to find a little bit of calm in this kind of storm that we have. Dr. Kopelman is going to talk to us a little bit about routines. You've probably heard or read something about that if you've been looking around on the internet or talking with your friends at all. So Dr. Kopelman, can you kind of remind us, why is it that routines are so important right now?
Yeah, well, thank you for that nice introduction. And yes, I think especially now more than ever in times of uncertainty, most children, as well as adults for that matter, do best when they're able to follow a structured and predictable routine. And speaking as a parent, I'll be honest that setting up routines for kids does require some upfront work and can be a little bit of a hassle, no doubt, but it can really pay off for a lot of different ways. First, routines make us and our children more efficient in the long run. We can go more on autopilot because we know what we need to do each day and exactly when we need to do it. In addition, if they're set up correctly, routines can help us make sure we get those important but less fun activities done, and make sure we've really carved out time for the more enjoyable activities that we actually want to do. Another benefit of routines is that they can make our children more independent over time and more confident. As they complete the routines every day, they'll become more familiar with what they need to do. And oftentimes that means they'll need less help from us, which is always a really good thing. And finally, having routines can definitely reduce stress and anxiety for everybody in the family. I think there's something inherently calming about knowing what we can expect in our day. And it's also just gratifying to be able to check items off of our boxes.
Do you have some suggestions about how parents might go about establishing those routines or even making changes to them if they've got some things in place right now?
Yeah, I mean, I'm guessing by now most people have already established some pretty nice routines for their children. So it might just be thinking about how to build on them. I can share the process for setting up routines that my wife and I went through with our own kids. As you know, we have children ranging in age from elementary school up through college. We have a first year in college who's now back at home taking classes. So first, we try to lump our daily activities just in a very straightforward categories. Probably because it was easiest, we started with things like, what time should they go to bed? What time should they wake up in the morning? When should we have meals and snacks? So just very basic choices. And once we had established that, we then moved on to thinking about routines for other organized activities like schoolwork, chores, and exercise. It's just as well as making sure that the kids had free time every day, which was obviously very important to them. And for me now, mainly that I'm working from home, I wanted to make sure that my schedule had time built in every day so I could check in on my kids briefly, especially my youngest one, to make sure that they were following their own routines. And then also making sure we had time for our family. We usually do that after dinner. So things like recently we've been on a little bit of a Trivial Pursuit jag, but we mix it up, movie nights, walks, different activities like that.
And how about some tips? I think there's probably some special ideas that you have that you could share with the listeners.
I will try, yeah. So I think how you set up a schedule and a routine, it's really different based on your child's age and their learning style. For example, with preschoolers, you might use a very simple, what we call picture schedule or visual schedule. So just pictures of the specific things you're hoping your child will do, along with what we call a lot of modeling or showing. For elementary students, if they can read, it might be a written schedule. For older high schoolers, or in my case, college students even, just shooting them a text might work as well. Another idea is that routines don't have to be the same every day. And in fact, they probably shouldn't be because that might result in boredom. I think it's really a good idea to mix things up to a certain extent. So depending on the day, it could look like different chores, different types of schoolwork. For example, in the Iowa City School District, they've made a recommendation that different subject areas are covered on different days of the week, which I like. Or days might even vary, as far as earlier or later bedtimes. The important thing I've found based on mistakes is to review any major changes that you make in schedules or routines with your children so they're not surprised or frustrated with you. And then a final tip is to try and involve your child in creating those routines or establishing them to the extent that you can. Just like adults, most children like choices because it gives them a sense that they have some control or ownership over what's going on in their lives. So even something as simple as chores, you could give your child a choice of like which chores they're going to do on different days of the week, the order in which within that day they're going to do their chores, if they want to listen to music or not, or other types of things while they're doing their work. So those kinds of simple choices I found can really make a positive difference and result in more buy-in.
Thank you. That's really helpful. And you sort of answered one of the questions that I had, which is what do you do when the schedule ultimately changes? You've got it all created, it's beautiful, and then there's a last minute surprise. And it sounds like what you're saying is to let the kids know as best you can, as early as you can, and then just move forward.
Yeah, that's correct. I think in these times, like you said at the beginning, we all have to be a little bit flexible. Yes.
Thank you. I'm going to talk to you a little bit now about communication and listening. And you've heard Dr. Kopelman talk a little bit about establishing routines. And within that, he mentioned giving children and teens choices. That's part of communication. And that also involves listening to their needs and their wants. So when you're creating that routine, one thing you can do is build in time to listen, to check in. Dr. Kopelman, I believe you said you and your family have check-ins on Sundays to kind of see how things are going.
Yes, we do. Yep, it's been very helpful.
Yeah, and that's awesome. If your family has something like that, that's great. I would also suggest just setting aside a few minutes every day. It doesn't have to be more than 5 minutes. And depending upon the age of your child, they may not have anything specifically they want to talk about, but you just want to make sure you have that option available for them. You might start a discussion by saying, what have you heard from your friends or seen on social media about the coronavirus? Or how are you feeling about what's been happening lately with everything going on? Give them an opportunity. Sometimes children may be experiencing things that they don't know how to express, or they may be worried that they're going to create more worry or strain for you as the parent. So you want to open up that dialogue with them. And I have kind of some special steps here to coach you through that. These come from some authors who have written extensively about children and parent relationships and communication. Their names are Faber and Moslish, and you can Google them and probably find lots of their books. But they have a kind of a 4-step process that I want to walk you through. And the first one of the steps is to just simply show that you are listening. Put down whatever it is that you're doing, set your work aside, put your phone away, make eye contact, get on your child's level. If they're younger and they're on the floor playing, sit down next to them. You want to really make sure they understand that you're listening and that they're being heard. For all of us, if we don't feel like we're being understood or listened to, we go to bigger and greater lengths to make sure we get our message across. And so you really want to set that time aside. And then the second step is acknowledge what is being said. So you can repeat back what your child is saying using simpler words. If you're not quite sure what to say, just nodding or saying mm-hmm is also a good way to let them know you're hearing them. And don't try to fix what's happening, what they're telling you. And this isn't the time to offer advice. Let them have their feelings and their experiences. So for example, you might say something like, so you were really excited about seeing everyone, and now that isn't going to happen if your child was expressing disappointment about an event that they won't be able to participate in. And that sort of gets into the third step, which is helping to label the feeling for the child. So you want to take a guess. If you're not sure, it's okay to label what it is that they might be feeling. This is a helpful educational tool for children to learn about emotions. And it also lets them know, again, that you're really paying attention. So you're feeling sad that you won't be able to see your friends for your birthday. If you're wrong, they'll let you know, and they may not really have a word for that. And so this is a way for you to problem solve and explore emotions with them. And finally, the fourth step, I really like this one, is acknowledging the fantasy that the child is missing out on. So a good way to do this is to start with, so you wish you could have. So you wish you could have had that party with your friends. So it sounds like you really wish you could have celebrated your graduation walking across the stage. Those are really important steps. It's just the listening part at this point. So setting aside time to do this is great, and possibly it'll come up spontaneously when you least expect it. And if you're in a moment when you can stop and follow those same 4 steps, show you're listening, put everything down, acknowledge what you're hearing, repeating back, labeling that emotion, and acknowledging what they wish they could have done or had, it will go far. So those are some steps for you to kind of think through. And then along those same lines, you may, in the process of having these discussions, get questions from your children. And the best way to handle these is to answer in a straightforward manner based on their age. So try to tailor your language and the words you use to the age of your child. There may be a lot of misinformation out there. They may be hearing things that aren't true at all or misunderstanding what it is that they're hearing. So you really want to hear what they have as questions. And then as best you can, you want to model that calmness and how to talk about feelings. And it's okay if you don't know. It's okay to be realistic about what you do know and share things like, we know washing your hands and following those routines works. And we know that children don't get sick very much. So there are things that we do know. And again, it's okay to acknowledge those that you don't. And at the end of our presentation, there are some references that you can look at to educate yourself a little bit or learn some ways to speak to children about what's happening right now. And finally, one comment: if you work at UIHC, which I'm assuming all of you do if you're listening right now, your child is probably or maybe worried about your health. So I think it's a really valuable time for you to discuss the safety measures that the hospital has put in place, the things that they're doing to keep us as employees safe. That will go a long way with your children as well. So in addition to the communication and listening, we know that learning how to regulate your own emotions, having those coping skills can be really important. And one of the best ways to do that is to actually model the use of those skills yourself. So there are a lot of really great presentations that have been done by Dr. Kopelman and I, our colleagues. So Dr. Hart did one, Dr. Garvin, talking about how as adults we can tap into relaxation and mindfulness techniques. If you are doing those things, you can bring your children in on them as well. And you can also teach them some to use on their own. So if you go back to Drs. Hart and Garvin's presentations, they talk about a grounding technique called the 5 sense technique. So you want to do 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste. Practice that, practice doing it with your children. That's a great way to kind of bring it back into the present moment. I want to spend a little bit more time talking about breathing. It's something we hear everybody saying, just breathe, just take a deep breath. But we actually know there is some research behind the idea of learning how to take those deep breaths and expand our diaphragm to help regulate our systems when we're feeling nervous or under stress. The best way to do this is to practice it actually when you're calm and not wait until you're really stressed out. And so again, practicing this with your children before bed or nap time or in a calm moment is a really wonderful way to get them to understand and practice the technique on their own. And so I'm going to ask everybody, including Dr. Kopelman, to, we're going to do this sort of in a way that's easier for children to relate to. So I want you to sit up nice and straight and think about your favorite warm beverage, like maybe hot cocoa, or your favorite hot food, maybe it's pizza or spaghetti. And I want you to imagine that you're holding it right here in front of you. For me, it's a mug of hot apple cider with cinnamon and spices in it. And while you're holding it, I want you to take a deep breath in through your nose and smell it. And then I want you to blow slowly on it to cool it off. So take a deep breath in and smell it. Blow to cool it off. Do it one more time. Smell it. Cool it off. Okay. So just some simple ways to make it a little more accessible for children. We know that this is a way that helps to calm your body down. We also know that it can just give you an opportunity to give your child something else to do if they're starting to become a little distressed or having difficulties with strong emotions. Again, practicing this when they're calm is the best way to go. Don't try to introduce it when they're in the middle of having a lot of panic or distress. That's a time when you want to go back and use the steps for listening and waiting until they're at a place where they can actually use the skills. And so at the beginning, we talked a little bit about some of the things that are happening for all of us with all of the changes and the uncertainty and how that can lead to sensitivity and big emotions. And there are some times when it may be important for you to reach out and ask for additional help or seek out other resources beyond what you're seeing or hearing right now. And Dr. Kopelman's going to talk a little bit about some of those warning signs and some ideas for how you can seek additional support.
Yeah, so like you mentioned, these are very challenging times for everybody. Excuse me. And so to an extent, these more intense emotions are just to be expected. That said, though, there are some potential red flags as parents that we should be looking out for. It really depends to an extent on a child's age and developmental level. But really, I think the important thing is we want to keep an eye out for patterns of major changes in your child's mood, your child's behavior, or any physical symptoms that might suggest your child's experiencing some distress. And this is not an exhaustive list by any means at all, just some examples. But in preschoolers, you might start to notice a child's going back to displaying behaviors that they had when they were much younger, but you thought maybe they'd outgrown. So now they're sucking their thumb again, or they're wetting their bed, or they're becoming much more clingy. They may have some difficulties with sleep that they didn't have before, like wanting to come back into your bed at night, or maybe more frequent tantrum behaviors. So those could be potential areas of like red flag or concern. In the elementary age children, you might see a child's becoming more withdrawn. They're not wanting to do things that they used to really like to do in the past. Or again, they might seem overly needy. They may start to ask questions repetitively. It could be about coronavirus, asking you lots and lots and lots of questions, or it could be other concerns that just suggest that they're worried. They may have nightmares at night, or they may have a lot of difficulty concentrating. Teenagers, a lot of the same areas, changes in sleep, and that's harder to figure out, being a parent of teenagers myself, given their sleep patterns, but staying up even later than usual, waking up even later as well. There might be changes in their activity level, what I call permanent zombie mode, just not a lot of energy anymore. They may have what we call interpersonal conflicts that are increasing, so just not getting along well with other people in the family or their friends, or they may start to describe physical complaints, stomach aches, headaches, a lot of soreness or tension. So all of those could be potential red flags, again, if there are changes in your child's behavior. And as you mentioned, we do have some resources listed at the end of the talk, if you do have those concerns.
Thank you. One other thing I wanted to mention about routine, also at the end of our presentation, we have some different websites that have activities. I've added a website that has books that they read aloud to the children. It's the authors of the books. And we also have an event that's going to be happening just for UIHC employees that have children between the ages of 2 and 5, where they can log in. I think it's 3 times a week. It's called Sing, Play, and Love. And they can join with other children and preschoolers for music, books, and dance. And that's a wonderful opportunity for them to get that piece of social connectedness, and for parents too to have that with their children. So you might want to build that into your routine. So hopefully we've given you some strategies to not necessarily fix everything for your children or teens right now. We know that that's not something that we have control over, which Dr. Hart talked about with radical acceptance. But we do know there are some ways that we can help to regulate emotions a little bit differently. So following those routines, but remaining flexible when you have to, modeling the use of coping skills, teaching some relaxation techniques to your children and using them yourself, and then also learning how to communicate and setting aside time to listen to your children and what it is that they're thinking about or wondering about right now. So thank you very much for taking the time to listen to us today.
Hello. Thank you so much for that wonderful presentation. I don't know if people heard me say, okay, guys, a minute ago, but that was for my family, not for you guys, to let them know. Quiet again. So I do have a few questions for you. I wondered if you could talk a little bit more about just sort of the new normal, because you mentioned how important it is to establish a routine for your kids, for your family, and yet at the same time, this isn't really a normal time for anybody. So how do we also remain flexible, or how do we figure out our new normal?
Yeah, so is it okay if I go first, and then I'm sure you have some thoughts as well?
Sure.
It is a challenge, right? Because things are different than they've ever been before. And I think we have to give ourselves a little bit more compassion and just awareness that we can't control everything and we can't do things just the way we want to. But at the same time, we, for our own sake and our children's sake, we do want to establish those routines because, again, it gives us a sense of predictability and control. So it's both being aware that life has thrown us a wrench, while at the same time, how are we going to respond to it? And the routines can be really helpful for that.
Right. And something interesting that I had read recently was talking about the fact that, you can't act as though this is typical. You can't pretend these things aren't happening. So modeling the emotions that you're having for your children in the midst of this is more than appropriate. We just want to make sure that we're also demonstrating the use of coping skills. So if we all as adults walk around and pretend that this is fine, that's going to probably be a little creepy for kids. So it's okay to say, I'm feeling a little confused today. The routine is going to have to change. And we'll be okay. We might need to do some relaxation, and then we'll go on to the next part of the day. So it is our new normal, and it doesn't mean that every day is going to go smoothly.
All right. Thank you. I really liked the idea of those 4 ideas for people, 4 steps for parents to follow. And when you're encouraging parents to listen and to kind of repeat back and allow a child's feelings and help them label their feelings and acknowledge their wishes, do you have any tips on how parents might be able to do this? Can you give some examples of how parents would label feelings for a child, or how they might follow up with some of the wishes that the kids are talking about?
Yeah, I'm really glad you asked that, because one of the things that we hear a lot, and this comes from children as well as teenagers, is I'm bored. And I think we can probably all relate to that right now. But in truth, sometimes bored is a word for an emotion that they don't know how to explain or articulate. So recently I heard a teenager say, I'm bored. And I said, well, what is it that you feel like you're not able to do right now? Because boredom is not having anything to do. And what it really was about was missing friends and not being able to participate in sports. And so then I could follow up and say, it sounds like what you're feeling is a little bit of sadness or loss because you're not able to have that connection with your friends. So that's one way that you can start to listen and label those emotions. You can tell by the person's body language, possibly by their tone of voice or their facial expressions. And you can use those as examples to label too. Wow, I noticed that you were kind of clenching your teeth and your fists when you said that. It sounds like you're a little bit angry. As far as the follow-up is fulfilling their wishes, is kind of maybe making a plan for when you'll be able to do those things again, or how can you connect with those people if it's missing friends in the meantime. Planning ahead, because we know this isn't going to last forever. We may not know how long it's going to last, but we will return to some of those activities. And so it's okay to plan ahead for some of those wishful events as well.
Do you have anything you want to add, Dr. Kopelman?
No, not actually. That pretty well covers it. So I agree that providing that information and being realistic can be very helpful for children.
All right. Thank you so much. We really appreciate your time today, Drs. Elizalde and Kopelman. Thanks for sharing practical steps that we can all take to respond to the coronavirus. A recording of today's live stream, as well as links to additional resources related to supporting children during COVID-19, will be included in the loop later today. And on Tuesday, we will be joined by Chris Klug, who will be discussing grieving. Until then, please take care. See you all soon. Thanks.
Thank you.